let's see some symptoms and management of liver cancer. We'll see for hepatocellular carcinoma alone. So symptoms of hepatocellular carcinoma in early stage doesn't produce any symptom at all. So early stage means very small tumor, single tumor present only within the liver, usually doesn't produce any symptom at all. But in later stage, when it is advanced, it has spread into adjacent big blood vessels, it has spread to different portion of the liver, it has spread outside the liver to other portions of the body. Then it produces certain symptoms like jaundice, abdomen pain, blood vomiting, accumulation of fluid within the abdomen, loss of weight, and loss of appetite. So when one develops these symptoms, it is in pretty advanced stage. So is there any way to identify it in an early stage? So as we discussed, hepatocellular carcinoma usually arises in the background of cirrhosis. So in cirrhosis, we can subject the patient to regular ultrasonogram or certain blood tests, which can give an idea that this patient may develop a liver cancer at this region. Okay, so having discussed about the symptoms of liver cancer, what are the diagnostic modalities available? The basic screening test is an ultrasound abdomen, which is done using a probe, and it checks the different portion of the liver. If any nodule or a tumor is seen, then we subject them for a specific test called as CT scan or MRI scan. Now CT scan and MRI scan are of different types. We should do what is meant for liver. So that is called as liver protocol. There are certain specific features of the tumor of liver if it is hepatocellular carcinoma in the imaging, which can be CT or MRI. If that is matched, one doesn't require a biopsy to prove that it is a liver cancer. So once liver cancer is established, the treatment depends upon whether it is a single tumor or there are multiple tumors or it has occurred within the background of cirrhosis. If it is a single tumor without cirrhosis, then surgery can be done. If it is a multiple tumor with cirrhosis and not spread outside the liver, liver transplantation can be done up to certain number of tumors and certain number of size. If it is very big in the background of cirrhosis and it has grown to an extent that transplant cannot be done, we have certain other treatment modalities like drugs and chemoembolization. So you would have heard about angiogram, in which we enter through the blood vessel and remove the blocks. This is the other way around. Angioembolization means entering through the vessels, going to the tumor supplying blood vessel, injecting chemo and then blocking the blood vessel supplying the tumor, so that it receives a toxic chemotherapy. At the same time, it is deceived of the blood supply also. So these are the treatment modalities available for hepatocellular carcinoma. Thank you.